Welcome back to Brain Buzz, where we delve into the fascinating world of neuroscience and brain health. I'm your host, Dr. Kimon Bekelis.
And I'm your co-host, Jason Wallen.
Well, thank you guys for tuning in again. This is our second episode of our podcast. And this month, we're going to talk about brain aneurysms.
And we couldn't pick a better month because September is Brain Aneurysm Awareness Month.
Absolutely. So, brain aneurysms are more common than what people think, and they can have a profound impact in somebody's life. So we want to spread awareness on them and educate, answer questions. This kind of fits nicely. In the first podcast, we spoke about stroke, which was the ischemic stroke, rather, where there's decreased blood flow to the brain. And brain aneurysms are when they do cause trouble, they rupture, they cause bleeding inside the brain. So that's a hemorrhagic stroke. That's a different type of stroke. And certainly brain aneurysm is the leading cause, one of the leading causes, not the leading cause, but one of the leading causes of a brain bleed.
Yeah, I mean, and that's why we are called the Stroke and Brain Aneurysm Center.
Absolutely.
So speaking about brain aneurysms, why don't you go ahead and give us your description of what a brain aneurysm is?
Absolutely. So a brain aneurysm is a soft spot in the blood vessel, right? It's an arterial problem. So it's in the large blood vessels that bring blood from the heart into the brain. So those blood vessels, they can develop a soft spot and then a ballooning on the side of it. A good analogy that we use frequently with patients is the car tire analogy. If you had a tire and you had a soft spot on the tire, you get a little ballooning. And within the same fashion, that does not necessarily have to rupture right away, but when it does, it can have profound consequences. So that's exactly what a brain aneurysm is.
And when we hear aneurysm, it doesn't have to be in the brain, correct?
No, absolutely not. Aneurysms can happen across the body in these large blood vessels that bring blood from the heart to organs or to the extremities, and they have different types of treatments across the body. Obviously, us as neurosurgeons and neurointerventionalists, we only treat aneurysms that involve the neck or the brain blood vessels. But certainly there's other specialties that deal with aneurysms across the body.
Yeah, and I would have no idea about any of that. We are very specialized, which is a good thing. What are some of the ways that we diagnose a brain aneurysm?
These days we have a multitude of ways to diagnose brain aneurysms, and those are generally the first test that somebody would get would be either an MRA or a CTA, that are MRI or CAT scan associated tests that look at the blood vessel specifically, and they can tell us whether there is a balloon or an outpouching on the side of the blood vessel, a brain aneurysm. And some large aneurysms can be seen even in studies that are not intended to look at blood vessels, like an MRI for another reason. Generally speaking, most aneurysms, unless they've ruptured and they've caused, obviously, a major problem, and we can talk a little bit about what happens when an aneurysm ruptures if you want, is that an aneurysm is discovered incidentally. You go to the doctor because you're having headaches, because you're dizzy, some sort of vague neurologic complaint. They would obtain an MRI, they would obtain an MRA, and then there folks can see a brain aneurysm. And a lot of the patients we see in the office, we see them because they were having some other issue, and in that setting, they got a study that showed a brain aneurysm. And I always tell them, obviously folks are frustrated that that's not what they were looking for. They got into a kind of a different path, but to some extent, it's a blessing in disguise. Identifying a brain aneurysm before it ruptured allows us to really make a plan about understanding it, determining the appropriate path for treatment, and then making sure that we take the right steps to prevent a catastrophic outcome. And some of the aneurysms, the majority of the aneurysms, we'll monitor, and when we do monitor them, it's a very benign process. So that's kind of how you would diagnose a brain aneurysm. Now, for brain aneurysms that are significant and we need to look into them further, then we proceed with other studies like a diagnostic angiogram, where we can really see the aneurysm from the inside and get information on it.
What might be a reason I think that I have an aneurysm, or I think something's going on? Signs and symptoms of an aneurysm.
Right. So often aneurysms, brain aneurysms, are called the silent killer, right? Because they rarely give warning signs. Sometimes they do, but they rarely give warning signs. They're there. They're enlarging, maybe potentially. Sometimes they rupture. Before that rupture, rarely we get warning signs. When we do get warning signs of an aneurysm before it ruptures, it typically those signs are typically in the form of either worsening headaches, or dizziness sometimes, or often if the aneurysm is large enough to cause compression of blood vessels, or of nerves rather, that control motion in the eyes, you can have vision problems. Double vision is a common issue when it comes to brain aneurysm. So these would be kind of the warning signs. Again, not very common, but when an aneurysm does rupture, it causes a very stereotypical presentation, and that involves the worst headache of somebody's life. So if our listeners get something out of this podcast, it should be that if they or somebody they know is experiencing the worst headache of their life, a headache that comes on within a split second, and it goes from 0 to 100 within a split second, very similar to if somebody were to hit you in the head with a hammer. People describe it as a thunderclap headache. That kind of headache is a very much an indication of a possible brain aneurysm rupture, and you need to go to the hospital right away in that setting.
So there's been people that have had brain aneurysm ruptures, and are able to walk around still, and are able to
Absolutely.
carry on their day.
Absolutely. So, and that kind of is a good segue to talk a little bit about what happens if an aneurysm ruptures, right?
Mhm.
So when an aneurysm ruptures, you get that horrible headache. Half of the patients will die right away. So they will never make it to the hospital. And often EMS arrives at the scene, and they interpret the whole thing as a cardiac arrest because the heart stopped, and they administer CPR in an effort to revive the heart. It's obviously very difficult to know whether the aneurysm ruptured or not because somebody collapses, loses consciousness. And so that's extremely important to understand that although brain aneurysms discovered incidentally, they might not be causing symptoms. If they do rupture, it's a catastrophic event. 50% of the patients will die right away, right then and there. Now, from the other 50% that will make it to the hospital, only a third will make it out of the hospital without any deficits. Another third will still not make it out of the hospital, and the last third will have some sort of deficit, stroke-like symptoms, inability to talk, move, things of that nature. That's why we say if you do have a significant brain aneurysm, it's better to fix it before it ruptures. And yes, there are patients who will have a rupture, milder form of rupture, and they will be walking around. They've had the worst headache of their life. We've had patients that 3 days later will come to the hospital. They say, I cannot shake off this headache. Get a CAT scan. There's blood everywhere in that area of the brain that indicates a brain aneurysm, the subarachnoid space. So they have a subarachnoid hemorrhage. And that's very significant. The reason it is significant is that a brain aneurysm does not, when it ruptures, it doesn't cause death and deficits just by virtue of bleeding and rupturing at that moment. It can cause trouble down the line in the first 2 weeks after a rupture. And that's why we keep any ruptured aneurysm, even the folks that are doing fairly well, that get treatment, we keep them in the hospital for at least 2 weeks, because that's the period where your blood vessels can get really tight as a secondary impact of the blood being around and circulating in the brain outside of the blood vessel. The blood vessels start to clamp down. That's called vasospasm, and that can cause a secondary stroke because now there's decreased blood flow going forward. So an ischemic stroke now, secondary to a hemorrhagic stroke. And we keep patients in the hospital, monitor their blood vessels with ultrasound and other tests. And if the blood vessels start getting tight, we have ways endovascularly, again, through the groin, similarly to what we've discussed before, to go up and release those blood vessels with medications or with balloons and prevent a stroke from happening. And so in these first 2 weeks, we monitor patients closely. We administer medications to prevent that vasospasm phenomenon. We monitor patients' electrolytes because, again, they can start wasting sodium and their salt levels are falling. And so all these secondary impacts on the body are very important. And really, that's the reason why a ruptured aneurysm has such a profound impact on somebody. Not just the fact that obviously by the sheer pressure into the brain. When the first an aneurysm ruptures, it can kill about 50% of the patients that are experiencing that. But also because the brain, it's so, the blood is so irritating to the brain that it can really have catastrophic consequences for the first 2 weeks. And yes, you can walk around with an aneurysm, and then we have a lot of patients that survive a brain aneurysm, but a lot do not.
Yeah, and when I was training somebody down at Jefferson, somebody new to the field, they were under the misconception that when somebody had a brain aneurysm rupture, that like blood poured out of like their eyes, ears, nose, mouth,
Right.
and that's what people envision sometimes, and they don't realize that a headache can
Right.
be that sign.
Right. And often we get questions like, people get a nosebleed and they have a brain aneurysm, and they're worried that that can be an indication of a rupture. That's not the case. The number 1, 2, 3, 4, 5 sign when it comes to a ruptured brain aneurysm is the worst headache of somebody's life. Remember that is extremely important. Identifying it, getting somebody to care can save somebody's life, because really treating that brain aneurysm after it ruptured is the first step to prevent another rupture, right? So to get a little technical when it comes to brain aneurysm rupture, when an aneurysm ruptures, the bleeding doesn't last long. The brain obviously is contained by our skull, so there's not a lot of room. So the bleeding happens, it lasts a few seconds, and then the pressure builds up in the brain, and that from the bleeding, and that pressure stops additional bleeding. It kind of tamponades the bleeding. But that small time of bleeding is enough to kill people and also to have a profound impact on the brain. Also, the aneurysm that now has been tamponaded by the blood and has a hole in it can re-rupture. And when aneurysms rupture a second time, and they do have a very high propensity to rupture in the first 24 hours, that's when almost everybody would die from the re-rupture.
Well, I would imagine it would be almost bigger.
Exactly.
It's a bigger hole that's going to be ripped.
Right. Very,
open.
very few people survive that.
Yeah.
And so that's why it's important to treat the brain aneurysm when somebody comes to the hospital. And then the process starts of us monitoring for vasospasm, monitoring for other issues that can happen. And so it's a really challenging situation when the brain aneurysm ruptures, right? Even for those that survive it, even for those that have a mild rupture, you got to be aggressive. You got to recognize it. Remember, worst headache of life, immediately to the hospital.
Yeah. I mean, that is very important. Like you said, it can mimic other pathology, and you think, something's going on,
right,
or whatnot. But yeah, paying attention to yourself and being self-aware, is a big part of it, and don't deny things that are going on.
Absolutely.
So when I was younger, I used to drive my grandmother crazy, and she used to say, you're gonna give me a brain aneurysm.
Right.
Which makes me think, why would one develop a brain aneurysm, or what would cause somebody to develop a brain aneurysm?
I can say that definitely you wouldn't give one to your grandma. So there's not a lot of external things that can cause a brain aneurysm or can cause a brain aneurysm rupture, right? That's a very common misconception. People think, if you have a brain aneurysm, you cannot scream, you cannot go scuba diving, you cannot get on a plane, changes in pressure, changes in how much pressure you put on your body, those can affect the brain aneurysm. We don't have solid evidence that that's the case. And when it comes to brain aneurysms, for the majority of the times, it's genetics, not the kind of genetics where you pass it on from generation to generation, but more so that your genes make you prone to develop a brain aneurysm. Smoking is one of those risk factors, maybe the only one that we know that can have an impact on the development of a brain aneurysm, but also on the risk of bleeding from a brain aneurysm. And then high blood pressure, of course, can put you at a higher risk to rupture a brain aneurysm, not so much to develop one. But other factors, not so much. We know, of course, that brain aneurysms are more common in women. We also know that brain aneurysms tend to rupture around the 4th, 5th, and 6th decade of life. And like I said, more common in women. And in depending on some
why is that? Because that comes up.
There is really no good evidence of why that's the case.
It's not us men.
No. No. We don't have that sad privilege, no. So these are kind of some things to consider, right? And also very important, strong family history of brain aneurysms or having had a previous brain aneurysm rupture puts you at higher risk to develop another one down the line. Family history, like I said, is important.
Mm-hmm.
There are familial brain aneurysms. Some brain aneurysms run in the family, multiple relatives, multiple blood-related relatives have brain aneurysms that have ruptured or not. In these cases, you have to be very aggressive at screening the whole family. Screening is very simple with an MRA, which has no contrast or radiation. You can really get an immediate answer about whether somebody has or doesn't have a brain aneurysm. So if you have a family with 2 family members that have brain aneurysms, then you should screen all blood relatives.
So being a little more specific though, like if I have my 2 cousins have brain aneurysms, does that mean I'm going to have a brain aneurysm?
It doesn't mean that you're going to have one. What it means is that you need to be screened though, because you have a higher risk than the general population to develop one.
Now, is there more if it's on my mother's side, my father's side?
No.
We have these certain diseases that are specific to that.
No, generally speaking, 2 blood relatives, first degree relatives in particular, is kind of what the guideline is. Then you have to be screened.
So if I have like an uncle twice removed, I don't have to worry about it.
Probably not.
Good to know. If now you said that most aneurysms are found incidentally,
right?
If and we've seen this where a patient will get a MRA or a CAT scan for a particular reason, maybe a car accident,
right?
And they're seeing a primary,
right?
And if the primary doesn't take, if I find out I have an aneurysm, what should I do? Because sometimes, and we've seen it unfortunately, where some people go, "Oh, you have a brain aneurysm. All right, have fun. Yeah, goodbye."
Right. If you do find you have a brain aneurysm, you can call us. All kidding aside, we tend to see brain aneurysms within a day or 2 of the diagnosis, and the reason is not necessarily that it's always an urgent thing, and that's unruptured brain aneurysms, right? Aneurysms that are asymptomatic. The reason we get patients to be seen quickly is because that diagnosis can cause a lot of stress. And
some people think it's a death sentence.
Exactly. So we try to get them in, reassure everybody, even the folks that need treatment, and we'll discuss treatments in a second, but even if somebody needs treatment, the treatment in the elective setting is fairly straightforward. So, but the majority of the patients will get monitored, and so that's what you should do. If you find out that you have an incidental unruptured brain aneurysm, give us a call. We will get you in as quickly as possible, and then we'll discuss any treatment options, prognosis, and everything else. Like we've said before, care is individualized. Everybody's different. Unfortunately, a lot of folks would go online when it comes to brain aneurysms, and that's not a bad thing. Educate yourself, but at the same time, the problem is online you'll see the worst case scenarios at all times, and the folks we see with a brain aneurysm, they're scared.
Family members are scared,
of course.
They want to treat them like with gloves on and not let them do anything.
Right. The family's scared, of course.
Yeah. Before we get into the treatment options, a very important question that I get asked frequently is: do all aneurysms need to be treated?
Oh, yeah.
And what would be the difference between them?
Great question. So they're absolutely not. Like I said, the majority of the aneurysms we monitor. Aneurysm is discovered in the setting of a random MRA for dizziness. We'll continue doing MRAs every 6 months to a year, monitor the brain aneurysm. We monitor for 2 things. We monitor for size and we monitor for morphology. And the Stroke and Brain Aneurysm Center of Long Island, being one of the pioneers in the field, we've been very good about integrating advanced technology in monitoring brain aneurysms. Like, we have artificial intelligence softwares that allow us to really monitor the brain aneurysms way beyond the human eye. And we can see small changes in the aneurysms that really will trigger us to say, hey, listen, this really needs to be addressed, needs to be fixed. But in the overwhelming majority of the patients, we will monitor brain aneurysms with a non-invasive test for a very, very long time, probably the rest of somebody's life. And if they don't change, there would be not much to worry about. There are aneurysms, and size is one important consideration. Larger aneurysms have a higher risk of rupture. Smaller aneurysms have a less likely risk of rupture. That being said, any aneurysm can rupture. We've seen aneurysms as small as 1 millimeter rupture, right? Yeah. Any aneurysm has the potential to rupture. However, if you do have a small 1-2 millimeter aneurysm, most likely nothing is going to happen. We have to monitor it. We wouldn't necessarily recommend treatment at that size because maybe the risk is not justifiable given the risk of rupture being so extremely low. But we would monitor these brain aneurysms, and again, if we see any change, if we see any difference, we would address it. But something that's important is the risk of aneurysm rupture, right? So the risk in general is very tightly associated with size.
Mm-hmm.
And if we assume a risk of about, say, 1 to 5% per year, considering different sizes, although large aneurysms, we're looking into 10 or 20% per year risk of rupture. But, if we consider something on the lower conservative side, the younger you are, the higher the chance of that aneurysm to rupture because you're taking that risk every year. It's like the stock market. It's compound interest. So every year, it's 5% or 1% on 5% on 5%. And so that increases your risk dramatically over time. And there's no good way of knowing how long an aneurysm has been around because, when you get that first study that shows a 5 millimeter aneurysm, you don't know, has that aneurysm been around for a while? Because you're not born with brain aneurysms. That's another thing that people ask us all the time. Are you born with these things? You're generally not born with a brain aneurysm.
And I've been asked, should we start screening kids for brain aneurysms?
Right,
so we have
right.
history and stuff.
You're really not born with a brain aneurysm. There's some aneurysms that kids are born with, and those are part of the familial or the hereditary type of aneurysm problems. And those are a little bit of a different discussion. But the general aneurysm discussion for the majority of the patients, you're not born with a brain aneurysm. And because you're not born with a brain aneurysm, you don't really know when it started to be there. And as such, you don't know what risk you've undertaken already. So that's very important to consider.
So as we get into the talk of treatment,
right,
I think it'd be good if, okay, so I find out I have a brain aneurysm.
Right.
I come see you in the office.
Right.
Walk me through me meeting you in the office for the first time. And then when we get to diagnosis and treatment.
So you find out you have a brain aneurysm, you'll get to see us very quickly, and then we generally would discuss same things like we're discussing here through the podcast and talk a little bit about what an aneurysm is in general, and then go specifically into the specific aneurysm, show you pictures, show you models of the brain aneurysm, and then based on the size, your family history, your risk factors, make a determination about whether we need to look into the aneurysm further or just monitor it every 6 months or a year with an MRA. The overwhelming majority of the patients will have the latter option, but the former will apply to some patients. So if that's the case, and we need to look into the aneurysm further, we generally would look into a diagnostic angiogram, which is a straightforward procedure we do through the groin or the wrist. We navigate our catheters and wires in the neck area and take pictures of the blood vessels of the brain. Those are very comprehensive pictures. It involves 3D renderings of the images of the aneurysm. And based on those, we make a determination. Does the aneurysm need treatment, or we should continue to monitor an aneurysm like that? And that's for marginal aneurysms. The larger ones, obviously, it's obvious. It's more for planning the treatment at that point. And treatment, if you may, can be twofold. Treatment can involve either an endovascular type of treatment, again, through the wrist artery or through the groin artery, or an open surgical treatment option. I would say majority of the patients, probably over 90% in our practice, would get an endovascular treatment. But about 10% will get an open surgical treatment. And that open surgical treatment involves a skin incision. The incision is typically behind your hairline, kind of in a C-shaped fashion. And we remove a window of bone. We go deep inside the brain. We take advantage of the natural folds of the brain. We don't go in the brain, but kind of in between those folds. Identify the aneurysm and put a clip at the neck of the aneurysm to really occlude the blood from going, prevent the blood rather from going into the aneurysm, right? So that's clipping. It's an open surgery. Obviously, if we have an endovascular option, we would rather have that.
Why is that?
Well, because, with an open surgical option, you're in the hospital for longer. And, there's obviously higher risk of infection and other stuff. But the overwhelming majority of patients will do phenomenally. But on the endovascular side, really, and I'll go through what that entails, really, all you have to worry about is a needle stick in the groin. So we go through the groin or through the wrist, navigate our catheters and wires again. We go up into that soft spot, into that balloon, and either stuff the balloon with platinum coils or other devices to prevent the blood from going into the aneurysm, or use stents to divert the flow away from the aneurysm and allow the aneurysm to naturally clot off and heal. And also, eventually, what the body does is the lining of the blood vessel kind of lines up the stent and seals off the aneurysm entirely. So these are curative interventions. And so we have the open surgery and the endovascular options. And like I said, both are equally good. But obviously, if you're going to get a needle stick in the groin and be back into your life in 2 days, it's a much more desirable outcome than obviously the open surgery. But there are cases where the safest option for the patient is the open surgical option. And in those cases, that's what we perform for the patients and give them their life back.
So just to clarify, both are safe options, both are good options.
Of course.
It's really the recovery that's the difference.
Exactly. It's the recovery that's the difference. And sometimes patient preference comes in the way, but I've yet to meet somebody who told me they would want open surgery versus the minimal invasive.
Yeah, I envision like Hannibal Lecter when they take the skull off,
right,
and you see the brain.
It's much less
for sure,
dramatic.
For sure. For our male listeners, can you really define when you say go through the groin? Because I hear
right
very much a lot of misconceptions.
Right. So really it's the artery in the leg area, right? So a lot of folks are worried that we're very close to the genitals and things like that.
Mm-hmm.
Not really. It's the femoral artery. The femoral artery is the artery that leads down your leg, and really it's off to the side. So there's no concerns. And that's a good question.
I'm sure you heard that in the office
all the
many
time.
times. You're going what, where, how, when?
All the time.
No guy,
Yeah,
go running for the hills.
Right.
Yeah, for sure. Okay, let's see. So the endovascular options, what are the differences between them? You kind of touched a little bit on them, but there are some major differences.
Yeah, definitely. So when you use coils or when you do use devices to obstruct the flow inside a brain aneurysm, you have some risk of the aneurysm coming back, right? Because if you put something in a sac, the blood flow can push that component back further into the sac, and then you have a recurrence at the base of the aneurysm, and then you need to do more to secure it. But if you're using a flow diverter or a stent that diverts the flow away from the aneurysm, and that area closer to the flow diverter seals itself off, then that is a curative procedure, right? But not everybody can get a flow diverting stent. There are some patients where there is a bifurcation or a fork in the blood vessel where you cannot really use a stent to divert the flow away. Most of the times there, ideally in those cases, you should use coils, you should use stents. That will allow the aneurysm to be treated.
So if I'm a patient and you're explaining this to me, and what I'm kind of hearing is if I get a clip, I have no more worries. If I get coils, there might be a chance. What percentage, chance are we talking about? Like,
so for coiling, the chance of an aneurysm coming back, especially in the ruptured aneurysms, is in the realm of about 10%. So 90% of the aneurysms will not come back.
So very low.
Very low.
And when they shouldn't worry.
No, and when they do come back, we almost always can treat them endovascularly the same way. So I wouldn't really worry. The upside is tremendous by the recovery process and everything else. It's really a miracle that we're able to treat these brain aneurysms and somebody they have surgery in their brain in one of the most sensitive areas, which are the blood vessels of the brain, and they walk out of the hospital the next day almost with nothing. I mean, how many times have we had patients challenging us about whether we did anything or not because they are not feeling the blood and the pain, and
they didn't feel anything, and they're like, I don't believe you. And you have to show them pictures and then proof. Now with a flow diverting stent,
right?
What is the chance of it reoccurring?
If the aneurysm is treated adequately and you have good sealing of the blood vessel, the aneurysm will not come back. Other aneurysms, of course, can develop, but that particular aneurysm will not come back.
Yeah, so it does sound to me, of course, I know, and doing endovascular, it would be I could show bias, but
Right.
no, definitely after talking to the patients, dealing with the patients, and seeing the recovery, and nobody wants to be in the hospital more than you have to,
Right.
us included. But
Right.
yeah, I think endovascular sounds like it's if it's possible, it's probably the way to go.
Right.
So the recovery process for a ruptured aneurysm versus unruptured aneurysm.
Right. Very different. Extremely different, right? So the on the unruptured aneurysm side, you're home the next day. I would argue you could probably go home the same day. The issue is that we want to monitor people after they've had a procedure like that, right? But folks go home the next day, and within a couple of days, they're able to do everything they want without any concern. On the ruptured aneurysm side, it's a different ball game. You're in the hospital for 2 weeks, so that by itself is a 2 to 3 weeks.
Mm-hmm.
Often patients will have some sort of deficit. Like we said, a third of the survivors will have some sort of deficit. So they'll be like stroke victims. And in these cases, you need extensive rehabilitation. Again, the same like we discussed in our ischemic stroke podcast. For those of you who've heard it already, it takes about 6 months to a year for this recovery to happen. And, obviously recovery happens even after that time, but the majority of it, and you might need intense rehabilitation. And again, it's a marathon. It's not a sprint.
Mm-hmm.
These are long recovery periods. And so that's the tremendous difference. And that's why if you do find that you have a brain aneurysm, if your aneurysm is large enough to justify consideration of treatment, probably you should consider going the treatment route, because in the event of a rupture, completely changes your life. If you survive it, of course.
And we've seen people, unfortunately, who had put off treatment because it didn't
Right.
fit into their schedule. It didn't, they wanted to go on vacation. They wanted to do this and that. And unfortunately, we don't have a time frame for when things can go south. And, people that put it off, because what happens, you put it off a little bit, you put it off a lot,
Right.
because there's always something going on.
Right.
And we've seen that, and we've seen the consequences of that, unfortunately, as well.
Absolutely. And that those are very sad stories, because we know we can help, and
Yeah.
we
And
don't.
frustrating, I think, from a provider standpoint. I would
Right,
I
we
would
don't get a
think, right?
chance, So and the patient doesn't get a chance, but we don't get a chance to help them, and so that's important. So, the message is obviously treat brain aneurysms with the respect they deserve. They shouldn't, if you have one, they shouldn't occupy your whole life.
Mhm.
If you're seeing a medical professional, if you're seeing us, somebody who really treats brain aneurysms and sees brain aneurysms, because that's the other thing. If this is monitored by somebody who doesn't treat them, you might not necessarily always get all the information. But if you're seeing somebody like us, and we're monitoring the aneurysm and we're keeping it safe, enjoy your life. Of course, don't let it consume your thoughts. But if there is a chance that it can be problematic or catastrophic, then I think considering treatment these days, it's so straightforward, and you see patients come in, they leave very, very easy. This is something that folks should strongly consider if obviously they fulfill the criteria for a treatment.
So if I'm a patient and I have an aneurysm and I went to a physician and they
Mm.
told me that we're going to monitor it,
Right.
and I have to take their word for it.
Right.
And so at what point, or what can I do to be more proactive in my care because we've had patients tell us this before. So, I'm being monitored, and what am I looking for when I need to be concerned that I'm not getting the right care or that something needs to be done?
Right. So I would say the first question is, who's monitoring your brain aneurysm, right? If somebody who does these procedures and treats brain aneurysms is monitoring it, then you are generally getting good advice, because that means that they're considering the options, and they're considering the risks, and they have determined that it's safer to monitor than treat,
Mhm.
right? And so choose the right person is the first approach, and then after that, the only thing really you need to look for would be developing the worst headache of your life. It'll be extremely uncommon if we decide that we're monitoring an aneurysm the size of 1 or 2 millimeters. If we decided that we're monitoring it, it is extremely uncommon they'll rupture. But if they do, that's what you need to look for and advocate for yourself. So, of course, I'm going to refer to a patient who I'm not going to name, but you
Mm,
know her, and she's very young when she developed her brain aneurysm rupture, and she had the worst headache of her life. And at the time, EMS was advising her that, it's just a headache, right? But she advocated for herself and convinced folks that really she needed to go to the hospital. And she did, and she had an aneurysm rupture, a very small aneurysm, about 1 millimeter. And she did phenomenal. And she was able to go back into a full life without any restrictions. And you wouldn't know it if you saw her today. And so making making that your priority to advocate for yourself when you have that worst headache of your life is really, really important. And we talk a lot about brain aneurysms, but awareness is not where we want it to be. And I think sometimes unfortunate events that happen in celebrities can bring more awareness into that. I think we've discussed a lot about Emilia Clarke when she had her brain aneurysm rupture, which was not public. She shared it after multiple years when she felt comfortable. And other people, the brain aneurysms are a lot more common than what people think. Most of the statistics out there are not accurate because we cannot really take a large number of patients and do cadaveric studies on them. Some folks say 1 in 50. Some folks are even more aggressive by saying 1 in 20, 1 in 10. It's tough to really put a number on the prevalence of brain aneurysms in the community. They're out there for sure. A lot of us walk around with unruptured brain aneurysms without knowing about it, but knowledge is power. So if you're one of the lucky few that does know about it and you're monitoring them with a qualified professional, then that's all you need to do, and always look for the worst headache of life.
Yeah, as soon as something happens to a celebrity or somebody who's in the spotlight, all of a sudden we get a lot of love and attention.
Right.
And the disease becomes headline worthy, and then 2 months later, or actually in this day and age, 2 hours later, something else is taken over and everybody forgets about it, unfortunately.
Right.
So yeah, I think you make a good point about being more proactive with things.
Absolutely.
A listener had asked some questions, and I sneakily put some of the questions that they had in, early on, because everybody tends to, when it comes to brain aneurysms, a lot of the basic questions are the same. But is there any preventative measures I can take to not develop a brain aneurysm?
Not really. So, contrary to cardiovascular disease and stroke, where controlling risk factors has an impact, with brain aneurysms, we don't have that luxury. Of course, smoking, like I said before, is one of those factors you can control. So if you're a smoker, for multiple reasons, quitting is very important. Brain aneurysm development is one of them. But there's not a lot of other tools we have to prevent an aneurysm from developing. We don't know much about the genetic aspect of brain aneurysms and the way they develop, that we would be able to say do this or do that. It's not something that has to do with exercise, or it doesn't really have to do with other risk factors that you can really control to prevent it from developing. But certainly listen to your body. If you're developing any kinds of symptoms that are indicating that there's something going on in the head, headaches, dizziness, things of that nature, or if you have a strong family history of brain aneurysms and are developing headaches again, get screened. See a professional that treats brain aneurysms. They would generally screen you. It's much easier when you see these folks versus the general provider who might not have the ability to get your studies approved and get you screened. And
we hear that a lot.
Yeah, and then that's part of dealing with insurance companies and everything else. But on our end, we are able to get you screened. And if you're screened and you don't have a brain aneurysm, that's great. If you do, that is really a blessing in disguise. And we can really make an impact and change the outcome of somebody's life by identifying these aneurysms.
Yeah, and at the risk of being taken out by a big tobacco, people don't understand. Everybody associates smoking with cancer,
right?
And that's kind of where it falls and lies,
right?
But they don't realize and the vascular problems. Not just brain aneurysm, not just heart, but even leg issues and everything else. How bad smoking is for you.
Absolutely.
really, really bad stuff there. What is the difference? And I think this is a great question, between a brain aneurysm and a stroke.
Oh yeah, so I think we get that question a lot,
Mhm.
and um, it's commonly people confuse the two, right? Unless you're in the medical field, you might not be able to understand which is which, right? And that kind of tags along what we discussed in our first podcast, and that's a stroke is a blockage of a blood vessel, or an ischemic stroke is a blockage of a blood vessel. There's no blood flowing into the brain. Brain tissue dies. In the brain aneurysm, there's too much blood. There's bleeding because the aneurysm is ruptured, right? And there's bleeding inside the brain. So two different types of stroke, very different, not enough blood flowing into the brain. In the first case, too much blood outside of the brain, dissecting the brain and causing damage into the brain. So that's a fundamental difference.
And this is the last listener question that we have, and so for some treatments, we obviously put patients on anticoagulation,
Right.
or they might be on it already,
Right.
and then they find that they have an aneurysm.
Right.
They're afraid that now their blood's thinner. Is that going to affect the aneurysm? Is that going to make it more likely to rupture?
Right. No, that's a great question. And that's a question that we get not only from patients, but for providers also. So, cardiologists put patients on blood thinners and primary care doctors, and they have a brain aneurysm. The first phone call we get from another provider is that, can I put him on a blood thinner? Can I put her on a blood thinner? And the answer is yes. If we're monitoring an aneurysm, if we have determined that an aneurysm is safe to be monitored, then a patient can go on any blood thinner, on any medication, really. It does not affect the aneurysm. It does not affect the risk of rupture. Now, if an aneurysm does rupture, the risk of death or catastrophic complications is dramatically higher with blood thinners on board. So, of course, you don't want to have an aneurysm rupture in somebody who's on a blood thinner. But the truth of the matter is, if the aneurysm is deemed safe, the care of the patient should not be affected at all by the presence of the aneurysm.
Yeah, I mean that's a good answer to a common question that we get.
Very common. All right, perfect. And you don't have any more questions, do you?
I actually have one.
Oh, you do. All
yeah,
right.
no, I'm gonna cheat, and I'm not gonna even label this as a listener question. We talk about awareness.
Okay.
What do you think should be done to bring more awareness into the light? Because we see both sides of it. We see, people walk out of the hospital with our treatment or and they're perfectly fine. And we see people that are ruptured, and if we feel like sometimes if more information was out there more.
For sure. So two things, and maybe I'll give a sneak peek into our future podcasts. But awareness is very important for the diseases we treat. Like we've said before, time is of the essence, and so timely care is important. So knowing about the problem and suspecting it at the patient level is very important. Patient, EMS, and then providers. And so we need to shed more light into brain aneurysms. And
do you feel that providers are adequately educated about them?
Even at the provider level, I think we can do more.
Like,
but
if people have headaches and stuff like that, they should be more apt to screening them.
For sure. And providers for sure, but I would say patients is even more important, right?
Self-advocation.
Absolutely. Yeah. And so there's a lot of national foundations and organizations that are providing awareness and are doing a very good job trying to get the word out and tell patients and communities and healthcare providers about brain aneurysm. So that's one component. But then each and every one of us on the provider side, as a brain aneurysm surgeon, we have that responsibility to spread awareness. And obviously what we do a lot of that. And these podcasts, this series of podcasts are part of that awareness effort. But also, we have for this month, for the month of September, that's Brain Aneurysm Awareness Month. We have free screenings for brain aneurysms at the hospital, where patients get MRAs, especially those with strong family history. We screen, obviously, the patients beforehand, but those patients were able to then provide screenings with MRAs and get the word out. And but certainly us working with those foundations and getting the word out is extremely important. And that's done either through events, through walks, through different avenues. We have brain aneurysm survivor events. And certainly, I think in one of our upcoming podcasts, we will have one of the leaders of one of those foundations to discuss brain aneurysm awareness and all the efforts that the industry is doing to get the word out and save more lives.
Yeah, I think that's going to be a great show when we get to it.
Absolutely.
So definitely something to look forward to.
Absolutely. So if you don't have any more questions,
I'm good. I'm good.
With that, I want to thank you guys for tuning in again and listening to our podcast again. We discussed all things that have to do with brain aneurysms. And of course, if you want to learn more about brain aneurysms, you can reach us through our website. That's www.strokecarelongisland.com. Or you can call us, email us. All our information is on our website. If you have any questions or concerns, reach out to us. Obviously, if you're developing emergent symptoms, always call 911. And with that, I want to thank you again, and we're looking forward to seeing you for our next podcast.
Yeah, take care.
Thank you.